Hello, good morning. My name is Melissa Kamak. I'm a third year student nurse at the University of Salford. I'm also a care support worker at my local trust, and I'm also looking to start my career at PICU in the next couple of months. Please could you introduce yourself and tell me a bit about your role?
I can. Good morning. My name is Eloise Neumann, and I'm an advanced nurse practitioner for neuro-oncology in paediatrics. So I kind of work with the medical team and oversee any of our children that are newly diagnosed with a brain tumour, and then help plan and execute their treatment and investigation.
What or who inspired you to become a nurse and ANP?
Okay. So when I was about 6, I think, my dad went into hospital to have an operation on his back. So I went to visit him, and I was fascinated by everything. I was touching all the tubes and the bed and just having a real good look around. And so yeah, from then I knew I wanted to be a nurse. And then the A&P part obviously came much later after qualifying. So I don't think there was anyone in particular. I'd heard of the role and just thought, actually, that's something that I could do. I think you reach a point in your nursing career, whether you then do management or you try and stay clinical, whether that in a different specialist role. And I didn't want to do management, so went for the A&P.
So where did you study then?
I trained in Southampton, the University of Southampton, many years ago.
Was that a degree then? How did it work?
So it's a bit old school now. So I did what we call an advanced diploma, which meant that I did some of my final year at degree level, but I got paid by the NHS still with the bursary system. Whereas if you did a degree, then you didn't get paid. So it was quite a good way of doing it. And then I topped up to a degree once I'd qualified, just by doing a dissertation.
That sounds like a great way of doing it. Now it's just degrees, isn't it? Everything's so expensive.
Yeah, exactly, yeah.
Could you tell me what your first role was when you first qualified?
Yeah, so I went into oncology, paediatric oncology, newly qualified. Yeah, at a busy regional centre, and I've never looked back.
And how did you find going into oncology straight away? Was it daunting, or did you just jump straight in?
No, definitely didn't jump straight in. It was daunting. I'd done a bit as a student nurse, a couple of placements, and that's when I really knew that I wanted to do it. But Southampton wouldn't take newly qualified, so I obviously didn't stay there. But I appreciated that you perhaps could have got some general experience first. But when I found somewhere that did take newly qualifieds, I knew that's what I wanted to do. I was quite lucky in the sense that when I first started, I was given a job in our kind of outpatient clinic. So for day treatments, so a lot of those children are a bit kind of better, and they're quite well come for treatment, so it isn't quite as daunting as a ward.
So what would you say your top tips are for newly qualified nurses going out in practice?
I mainly just kind of take it one day at a time, or kind of one shift at a time. Set your standards low, not in terms of your care, but don't expect too much from yourself. Ask lots of questions, learn on the job, and just enjoy it.
Great, that's really helpful, because there'll be a lot of students, myself included, we go out in practice and sometimes we just don't really get the best experience. We're all very nervous at first, and if we're not kind of guided into it, it can really affect our confidence. So that's really helpful.
Massively, yeah. But just try and enjoy it.
So what would you say are some of the hardest challenges that nurses face today? Just briefly.
Yeah, where do we start? I think probably the fact that you guys are expected to come out and suddenly gain all the clinical skills as well. Whereas before, you had kind of longer supernumerary periods, and you were very much, I was encouraged to just chat to the parents and the families and play with the children. Whereas now, I see a lot of guys and girls on the ward, and they're trying to do their IV drugs kind of straight away and go on the courses. And yes, that's all relevant and useful, and it is a huge part of the work, but you need to get the people skills and the communication skills, because again, as a student, you don't always have that chance either.
It's really interesting, actually, because one of my competencies this year as a third year student is cannulation and venipuncture, all these kind of skills which I wouldn't expect to be doing till after I qualify.
Even a lot of newly qualified, not even newly qualified, but a lot of qualified nurses don't do them. So there's a massive shift.
Yeah.
We're expecting you to have all the skills that clinical nurse specialists or advanced nurse practitioners have.
I mean, one way it's a really good thing, you know. I'm going to qualify with all these extra skills, but it is a lot of pressure on students. Perhaps, you know, it wouldn't be a bad thing to not have them doing those skills straight away, perhaps.
Yeah.
So could you share with us a typical day in your life at work?
Yes. So generally get to work sort of 8:30 in the morning, go through any emails that I've got, and then get ready for handover. So in that time, I might be checking some blood results as well for our patients. So because of the A&P role, I work alongside the medical team. So we have a medical handover at 9 o'clock, and then we start the ward round, and I'll review any patients that we've got on our inpatient ward, and kind of assess them and review them for the day, make the plans of their care and treatment. Then if we've got any patients on our neurosurgical ward, I'll go and see them. And then we hand over again back to the nurses to obviously so they can plan the rest of their day, and then carry on ordering any investigations for the patients that I've got, perhaps go to clinic and see some patients. There's usually a meeting or two somewhere in the day. And then possibly review patients again later on, or I'll go back and just touch base with the families and check that they're okay.
Is there a skill that you found the hardest to master, would you say?
Probably cannulation, but only because I don't really use it a lot. So all the oncology children have central lines put in quite early on. So we don't really need to, they don't need a lot of cannulas. So therefore it's not a skill that I'm particularly confident with. I can do it, but I would rather one of the doctors or someone else did it if it was needed.
As an A&P, you have a lot of skills, as you've just, you know, discussed about your day. What would you do for self-care?
I like to run. So yeah, on weekends and evenings, then I'll go for a run. And also spend time with my family and chat to friends and colleagues about work, good or bad.
That's a really good way of, you know, releasing the stress of the day. Running, I think, definitely. It keeps you healthy as well.
Exactly, yeah. And sometimes I run with a friend, which is great because we have a good chat while we go, or kind of chat as much as you can. Or I'll go on my own and listen to a podcast or some music, and it's just nice to have that kind of downtime and peace and quiet away from people chatting at you constantly.
Do you have a particular nurse or person in healthcare or medicine that has inspired you to develop in your role?
A few, I guess. So initially, as a student, I had a really good mentor called Bex, and she was brilliant. You know, you could tell she was on shift because she was just so bright and bubbly. And I thought, actually, I want to be like her. And she seemed to know everything and know everyone and had a good handle on kind of the whole ward and team. And then I guess more of an A&P role is probably some of the consultants that I work with, because they've seen in me the potential, and then kind of really pushed me to develop the role and do better, and yeah, believe in myself, because it is very different. You are seen as equivalent to a medical doctor, which is quite daunting.
Yeah. So it's really good to have that support on the team, definitely.
Yeah, I'm very lucky. We've got a good team of consultants.
So if you wasn't going to be a nurse, what would you do in your life?
So growing up, I wanted to be either a brain surgeon or an astronaut. Then I realised I was scared of the dark, so I didn't want to go into space. And then the other thing that really interested me was geography and volcanoes in particular. I really like volcanoes. So whether or not I would have done it, but...
Could you perhaps tell us a time in your nursing career that's been the most difficult?
I mean, obviously working in oncology, lots of days are difficult from that side of things, with the kind of breaking bad news or telling parents and children that their disease has come back. so that never gets any easier. But there's not obviously a particular standout moment. I guess actually trying to then do my A&P qualification whilst working and having a small child, that was a whole different challenge in itself. But we see it with you guys. A lot of student nurses are coming into it slightly later, and they already have families.
It's so challenging.
Oh gosh, yeah, I couldn't have done it.
I just take every day as it comes, but I do have a really good support network, so that does help, doesn't it?
That's what you need, yeah.
So would you say that's perhaps what you find the most difficult, balancing like family life with?
Yeah, massively, yeah. But I'm lucky now that with the A&P role, I can work more kind of 9 to 5 type hours, Monday to Friday-ish, not necessarily that strict, but it does help with the work-life balance.
Yeah, that sounds like a perfect balance, actually. And you're doing the job that you love, so.
Yeah, exactly, yeah. I am lucky.
Yeah. So could you tell us a memory in your career which you're most proud of?
Yeah, so I've got 2 actually, and they're quite recent. One is to do with a patient. So last year, we found out that she was a big fan of Paul O'Grady.
Okay.
This is a young patient, so quite unusual. But we managed to put it on Twitter that she really liked him, and eventually through social media, and obviously with the child and mum's consent, we were able to get the patient live on the radio with Paul O'Grady, then rang her to speak to her. So yeah, that was amazing, and just the joy on her and her mum's face was brilliant. So I'm really proud that we could do that. And then recently I was nominated for a Paediatric, it's a PAFTA award. So basically it's a medical training award. So each deanery around the country, I think, hold their own equivalents. And I was nominated by one of our old registrars as a non-clinical hero. So that was really nice to be recognised for being supportive and a good role model.
As students, could you give us any advice in regards to starting a placement within haematology and oncology?
Yeah, it's going to be tough. Obviously, we don't win them all. Some patients, unfortunately, are very sick. They don't always make it. Their treatment is hard. And it's okay to be upset by this. It's okay to be bothered. But you can read around it to begin with, but really you just need to get there and try and make the most of your time with us. So talk to the families, play with the children, find out what it's like from their point of view, as well as try and then learn the background knowledge from the nurses that you guys are working with and from the specialist team around you.
That's really helpful. So what's the one thing that students could do when caring for a child with cancer that might make a difference?
Just to listen and to play. I think especially at the minute, obviously with the whole pandemic that we're in, we're only allowing one parent still to be with their children. So they can swap, but we're only allowed one adult on the ward at a time. So that's quite full on for some of the families. So, make them a drink, offer to sit and just chat to them or play with the children. They seem very normal, but I think some people are still a bit nervous about doing it. But yeah, I think, and that's where you learn a lot. And the parents become experts themselves on their disease and the conditions and the treatment, so you can learn an awful lot from them.
In regards to COVID, so we know that children with cancer are perhaps more vulnerable to infection. So would you say that COVID has affected them a lot more than other children that haven't got cancer?
No. So I think generally we know that children are fine with COVID. There obviously are some, unfortunately, they do get quite sick, but not nearly as, the numbers aren't the same as in adults. And I think we've done lots of research that children with cancer and who are immunocompromised are at no more risk of being severely ill with COVID than other children. But obviously we still want them to take their precautions.
Where do you see your career in 5 years' time?
Unfortunately, not retired. I wish. I guess just doing the same kind of thing, but hopefully providing even better service. Maybe there'll be more of us that can I really like the fact that I'm kind of a continuity person for the families, whereas the doctors will change every 6 months to a year, whereas I get to be with that patient for most of their journey. So if there could be more A&Ps that can do that, then that'd be great. And I would really like to be able to, for us to be able to provide all the same treatment or better, but with less side effects. Obviously, that's not just going to be on my role, but
is there any resources or any advice that you could give to any of our followers?
Yeah, so there's a great charity and organisation called the CCLG, which stands for the Children's Cancer Leukemia Group, and they've got a brilliant website with lots of resources for professionals and also for families and lay people. So definitely worth a look. And there's also the brain tumour charity. HeadSmart is a really good tool which tells you all about the signs and symptoms of brain tumours in children, but from babies, young children and teenagers. And it's got a great song as well that's very catchy. So look it up.
So for our followers watching the video, what's the main thing that you would want them to get out of it?
That it happens. It's very rare. Obviously, if you work in a regional centre, it doesn't appear that rare because you see lots of children with it, but it is still rare. But we cure an awful lot of children, so it's not all doom and gloom. And actually, the kids are so resilient and so brilliant that you can enjoy your job, even though by the title alone it sounds quite depressing. But I love my job and I love going to work. So
good, that's been really, really helpful.
Just be aware.
So much for meeting with me today.
You're welcome. Thank you for interviewing me.
Really enjoyed it.